Dilation versus photos, they each have a time and place. Hey everyone, this is Dr. Melody Tavicoli from Dr. Tav Consulting, and in this video I'm going to talk to you about the difference between getting your eyes dilated or having retinal photos taken. So traditionally, optometrists weren't even allowed to use eye drops, so we started off as just being able to do glasses, and eventually we got the legislation to be able to use eye drops. Dilation involves a couple drops. The first one is a numbing drop, which kind of stings, but it prevents the next few drops from not stinging, and it actually helps the next few drops get in a little bit better. So you use an anesthetic drop, and then there's two different muscles that are controlling the iris to help open up the pupil, and there's usually one drop for each of those muscles to open up the pupil. The reason you want to open up the pupil is it is meant to shrink when you look at a light to help protect your retina. However, we need to shine bright lights in your eyes to be able to see back there, so we don't want the pupil to get small on us. We need it to be dilated so we can look inside the eye and all the structures inside. Looking at the lens, looking at the vitreous, looking at the retina, the optic nerve, the macula, and making sure everything's healthy back there. So dilation is a traditional way to check the inside back health of the eye. There are a few cons. First, the drops sting. Second, they take 15 and 20 minutes to work, so you have to wait at your appointment. Third, you become really light sensitive, and then the doctor shines some really bright lights in your eyes and asks you to keep your eyes open. So it can be a little bit difficult, maybe slightly uncomfortable, but not harmful. And fourth, the biggest issue is you stay dilated, your pupil stays large for several hours. Now, yes, there is a drop you can put in that helps shrink the pupil back down, but it has all sorts of issues and it's not traditionally used. So there is a time and place for dilation. If you have flashes and floaters, if we think something's going on in the retina, absolutely dilation needs to be done. However, the newer technology of retinal photography involves actually taking a picture of the back of the eye. There is a camera designed to scan the back of the eye. Some just do the central, some can go out further and look at the periphery of the retina. And it literally takes a picture. It's a bright flash, but it doesn't involve drops. It doesn't involve waiting around. It doesn't involve any side effects. I personally used to not like the photos. I thought it was just a way to sell something and it wasn't really necessary. And you can technically see more if someone dilates really well and you're really good at checking the back of the eye. However, the cameras nowadays are really good. You can get really detailed pictures of the back of the eye without any side effects. I actually prefer the photos these days because I'm able to catch tiny little things that I might have missed when I was shining a really bright light in your eye and you were uncomfortable, versus being able to expand, zoom in, change the filters, look at different layers of the retina, all through the photo. Nowadays, I recommend the photos for everyone. I think they're an amazing tool to check the inside back health of the eye. Most insurance companies don't cover it because they don't want to, and that would be an extra charge, but it is absolutely worth it. If the optometrist sees something on the retinal photos that's concerning, they can then dilate your eyes or refer you to the appropriate specialist. Another advantage of having the photos is being able to track things over time. While we do take good notes and actually chart, different things and sizes of lesions that we see, having a picture is worth 1,000 words. Having a photo to send with your referral and to actually show you, the patient, what's going on in your eye is an amazing tool. I highly recommend next time you're at your optometrist, your yearly annual exam, that you get photos taken of the back of your eye. If there's an extra charge, it's totally worth it. It's easier on you as the patient, it's easier on the doctor, and it's a very effective way to check what's going on in the back of the eye. So to wrap up, dilation versus photos, they each have a time and place. I think an annual routine exam should include photos, so make sure you opt to get that done, and your optometrist can go over what's going on in the back of your eye. If a dilation does need to be done, it can absolutely be done. Just be aware you're going to get those cool glasses after because you're going to be really light sensitive. If you have any questions, put them in the comments below. Hope that helps. See you next time.